let's continue our lecture. Okay, so can you see the slide?
Yes, sir.
Okay, treponema was a group. This group is important in causing acute periodontal conditions. For example, AUNG, both okay. And one of them is this disease, also known as Vincent angina or trench mouth, right? So later you can see this is especially in the poor dental hygiene, oral hygiene patient, and immunocompromised patient. And then it can also lead septic emboli to lungs. One of the major leading cause of the Vincent angina is the septic emboli towards the lung, causing leading pulmonary abscess and empyema. Empyema is also the pus, right? And treatment first includes the local treatment, irrigation and removal of the necrotic area of the necrotic tissues, right, of gingiva and related alveolar bone and teeth. And then we can give oral metronidazole. Because in untreated cases, infection can spread to the bones. Perfect. These were some bacteria involved in different disease. For your interest, you can have a look at them. But the important bacteria to remember are still gram-positive bacteria, gram-negative bacteria cause periodontal disease. Okay, and this is the distribution of bacterial type by location. If there is supragingival plaque above the gingiva, gingival mucosa, then it is at the tooth surface, mostly gram positive. Tooth surface gram positive, outer surface gram negative. And tooth associated subgingival plaque mostly are gram positive, and progressing apically are gram negative. And then we go to the subgingival plaque, tissue associated. When there is tissue associated tissue, then there is gram negative rods and cocci. So tissue associated is gram negative rods and cocci. Tooth associated is cervically is gram positive rods, and then progressing apically towards the apex, towards the root, going downwards is gram negative rods. So this is an overview of the positive bacteria found on the gingiva and tooth associated gingiva and tooth tissue associated gingiva plaques formation. These bacteria basically form the plaque. Superiorly or superficially gram positive cocci and short rods, and then when you go towards the apex and the tissue associated and tooth associated, are more gram negative. So now main types of periodontal tissues. There are two types of periodontal tissues, gingivitis and periodontitis. Gingivitis and periodontitis are the two basic forms of periodontal disease, and each has a variety of forms. Gingivitis has acute, chronic, and acute ulcerative necrotic gingivitis, also known as trench mouth, also known as Vincent's angina. These are the types of gingivitis. And then periodontitis are chronic, aggressive, and necrotizing. So chronic periodontitis, aggressive periodontitis, necrotizing periodontitis. Anyone remember a aggressive periodontitis caused by?
Actinobacillus.
Perfect. Actinobacillus. Yes, good. So let's start with gingivitis, because now we know periodontal disease. We have an overview of periodontal disease, the important bacteria involved, what are the location by plaque formation, how it is formed. First is plaque is formed, then gingivitis, then periodontitis, and then aggressive or severe periodontitis. And now we know the two main types of periodontal disease, gingivitis and periodontitis. Now we go for gingivitis. What is gingivitis? Gingiva inflammation. Healthy gums are firm and pale pink and fitted tightly around the teeth. So the gums which are healthy, they are firm, hard to touch, pale pink, the color, and fitted tightly around the teeth. The tissue is tightly around the teeth. The gums, the gingiva is tightly fitted around the teeth. But when there is inflammation, infection of the gingiva, the sign and symptoms include swollen or puffy gums, dusky red, other than normal pale pink, it's dusky red or dark red gums. Here you can see they're inflamed. Gums that bleed easily when you brush or floss. So when you are brushing or flossing, you are getting a lot of easy bleeding, easy bruising, so easy bleeding, then gingivitis. Bad breath, halitosis, receding gums, open gums, pocket formations, and tender gums, hard to touch, and when you're brushing, they are having some pain. So gingivitis symptoms: inflammation or swollen gums, dusky red, dark red gums, bleeding gum, halitosis, tooth pain or sensitivity. These are swollen, receding gums, and then these tender gums. And as you can see, February, gum disease awareness month. Okay, so this is the introduction of gingivitis. Inflammation of gingiva, these are the signs and symptoms. Okay, again, signs of periodontal disease. Here you can see that plaque formation or tartar calculus formation and inflammation and pockets deepening. So you need to remember how it progressed. It progressed by plaque, and the plaque hardens into tartar and then cause a periodontal inflammation. But because here it is gingiva, the gingivitis, and then the deepening of pockets, deepening of pockets between tooth and gum. So there is space, and the bacteria go in and cause disease, periodontitis. Okay, risk factors. What are the risk factors causing gingivitis? Many of you already know some of these, like poor oral care habits, of course, then smoking or chewing tobacco, older age. Why? Because there are immunocompromised states. Dry mouth, poor nutrition, including vitamin C deficiency. Vitamin C deficiency causes. Anyone? Scurvy, perfect. So yes. Okay, dental restoration that don't fit properly, or crooked teeth that are difficult to clean. So dental restoration also cause gingivitis because it inflames the local tissue, gingiva, and crooked teeth attrition. When you bruxism is a disease in children. Bruxism, when the teeth they grind their teeth against each other, attrition, wear and tear, physical damage, attrition. They grind the teeth of upper jaw and lower jaw together, and the teeth are broken, crooked teeth found in the children. Bruxism, difficult to clean. When difficult to clean, plaques will be formed. Plaques will cause gingiva or gingivitis, sorry. So conditions that decrease immunity, such as leukemia, immunocompromised, HIV/AIDS, immunocompromised, or cancer treatment. Cancer treatment renders the patient, makes the patient immunocompromised. And when there is immunocompromised states, a lot of disease come in. Okay, certain drugs such as phenytoin, hormonal changes such as those related to pregnancy, menstrual cycle, and use of birth control pills, PCBs, OCPs, and then medical conditions such as certain viral and fungal infections. These are the risk factors. Again, we go for the gingivitis risk factors. We have smoking, dry mouth, defective dental restoration, some diseases such as comorbidities, immunocompromised, diabetes, cancer, HIV, genetics, crooked teeth, bruxism in children, age-related, especially in old age, certain viral and fungal infections coexisting, oral medication, poor nutrition, medication, when you remember phenytoin, and poor oral care habits. And this is clinical health, and this is gingivitis. As the risk factor increase or behavior risk factor are absent, then gingivitis can occur. You can see. So this is antibody polymorphonuclear cells, T and B cells. They cause this state, and antigen virulence factor and LPS, lipopolysaccharide gram-negative bacteria, cause chronic resolution of inflammation. This is a dynamic state. General classification. Generally, gingivitis can be classified into mild, moderate, and severe. And there is another classification which is associated with another situation, such as marginal gingivitis, seen at the margins only, drug-induced like phenytoin, and pregnancy-induced gingivitis. So we have two classifications: general and situation or associated, mild, moderate, and severe gingivitis, and then there is marginal, drug-induced, and pregnancy-induced gingivitis. Here on the right side, you can see normal is pink colored mucosa, and then erythema with bleeding tendency, mild gingivitis. Then there is edematous swelling and more tendency to bleed easily, moderate gingivitis, and then severe hyperplastic enlargement, greater erythema, more severe tendencies to bleed, and easy bleeding is severe gingivitis. What is the etiopathogenesis? What is the pathogenesis? How gingivitis cause? The most common cause of gingivitis is poor oral hygiene that encourages plaque to form on teeth. So as we remember, plaque should form of the, and then bacteria cause inflammation. So poor oral hygiene, we have not cleaned our teeth properly. The patients have not cleaned our teeth properly, their teeth properly, and then plaque will be formed. The plaque formation of plaque initiates the periodontal disease, leading to gingivitis initially and causing inflammation of surrounding gum tissues, gingivitis. Formation of plaque on teeth. How the plaques are formed? Plaque is a sticky film composed mainly of bacteria that forms on the teeth when starches and sugars in food interact with bacteria. So bacteria are there, starches and sugars in food, they break down, the bacteria break down the starches and food, sugars in the food, and then they will release some acids and make some plaque. Plaque requires daily removal because it reforms quickly. That's why we need to take care of our oral hygiene on the daily basis. Floss, brush, teeth brush, and floss. Turning of plaque into tartar. So once the plaque is formed, now it has to harden and change into tartar, also known as calculus. Plaque that stays on the teeth can harden under the gum line into the tartar. Okay, plaque that stays on the teeth harden under the gum line into the tartar, also known as calculus, which collects bacteria. So now plaque was formed by the degradation of by the bacteria of what substances? Of the starches and sugars in the food. Then they release some acid and plaque is formed. Plaque, once it is there, it stays on the teeth for a long time. Then it changes into a hard substance under the gum line known as tartar or calculus, which collects further bacteria. So further bacteria invited. So now there's a party. Previously, some bacteria were there. They had some food, and then plaque formed. And then plaque stayed, and then the bacteria say, okay, let's invite more bacteria because we have food. So let's make it tartar, calculus, harden it. Okay. Tartar makes plaque more difficult to remove. Then you need, that's why you need to scale. You need the scaling. Creates a protective shield for bacteria and causes irritation along the gum line. So tartar makes the plaque more difficult to remove. So we need to remove the plaque at the plaque stage. Gingivitis. So first there was bacteria making plaque, plaque turning into tartar or calculus, and now the gums will be swollen and bleed easily, the local tissue. Gingivitis. Gums become swollen and bleed easily. There will be tooth decay, which can also result into, because the bacteria can also cause enamel caries, dental caries. Remember, enamel, dentine caries. If not treated, gingivitis can advance into periodontitis and eventual tooth loss. So gingivitis, you remember the progression, right? Normal teeth, then plaque formation, and this tartar initial formation is gingivitis. Then there was periodontitis, and then there was severe periodontitis or chronic periodontitis, right? So if not treated, gingivitis can advance into periodontitis, which is the other part of the periodontal disease. We have two main types of disease: periodontal disease, gingivitis, and periodontitis. Complications. Untreated gingivitis can progress to periodontitis, a much more serious condition that can lead to tooth loss. So that, because there is, the end result is tooth loss, we want to prevent the loss of the teeth. That's why we are not letting it to progress into periodontitis. Chronic gingivitis is associated with some systemic disease such as respiratory disease, diabetes, chronic artery disease, stroke, and rheumatoid arthritis. Some research suggests that the bacteria responsible for periodontitis can enter the bloodstream through the gum tissues, going to heart, endocarditis, lungs, empyema, and other parts of body, causing different disease like such as these. So we have some association. So we need to prevent gingivitis too. French mouth, also known as necrotizing ulcerative gingivitis or Vincent's angina, is a severe form of gingivitis that causes painful, infected, bleeding gums, and ulcerations. French mouth is a rare disease today in developed nations, though it's common in developing countries that have poor nutrition and poor oral hygiene. Okay, perfect. So how you diagnose gingivitis is, now we move to diagnosis. As you remember on the right side, we have to take medical history, radiographic evaluation, extraoral examination, intraoral examination, and additional tests. So these will help in the diagnosis. These tools will help in the diagnosis of gingivitis. Now let's see how we use these tools. Examination of teeth, gums, mouth, and tongue for the signs of plaque and inflammation. Intraoral examination. Measuring the pocket depth or deepening of the pocket. By inserting a dental probe, you see this on the right side, this is a dental probe. This is a dental probe. This can help in measure. They are of different sizes, different diameters. Different diameters probes can help us to know how much the pockets are widen and deepen. By inserting a dental probe in the groove between the gums and the teeth, known as gingival groove, gingival sulcus, usually at several sites throughout the mouth. In the healthy mouth, the pocket depth is usually between 1 to 3 millimeters. So healthy, it is 1 to 3 millimeter. 1 to 3 mm is healthy. More than 4 mm indicates gum disease, such as gingivitis or periodontitis. Dental X-ray to check for bone loss in areas where the dentist sees deeper pockets. This is how you diagnose periodontal disease such as gingivitis and periodontitis. You see plaque development intraorally, you see the tongue, you see the mouth and gums for inflammation. Then you measure the pocket's depth. If to 1 to 3 millimeter, healthy. If more than 4 millimeter, gingivitis and gum disease. And then check, then X-ray. Now we go for the treatment. There is professional cleaning, dental cleaning, there is dental restoration and ongoing care. So professional dental cleaning. The initial professional cleaning will include removing all traces of plaque, tartar, and bacterial protests. So this is known as scaling and root planning. So from the crown to the root, we have to remove the plaque, tartar, and bacterial products. This is known as scaling and root planning. Scaling removes tartar and bacteria from tooth surfaces and beneath the gums, whereas root planning removes the bacterial products produced by inflammation, smoothens the root surfaces of the teeth, discouraging further build-up of tartar and bacteria, and allows proper healing. So scaling removes tartar and bacteria from the tooth surface, and root planning towards the deep side, and it avoids further build-up of tartar and bacteria and allows proper healing. So pockets will be healed. Other than professional dental cleaning is dental restoration. We can cap it, we can give some oral medication and then cap it so that further damage is not done. And once it is healed, we remove the temporary caps. Ongoing care is gingivitis usually clears up after a thorough professional cleaning. As long as you continue good oral hygiene at home and you come for the visit to the dentist, it's gonna help. How long before gingivitis clears up after treatment? 10 to 14 days. After the treatment, we need at least 10 to 14 days so that the gingivitis, the inflammation of gums, recedes, heals. How to do it? Good home hygiene. After treatment, after professional cleaning, you go to home, brush at least 2 times per day, clean between teeth using a pick or water flosser, stop smoking, limit sugar and sugary drinks, rinse with your mild mouthwash or mouth freshener. This is the treatment. And how to prevent it is by brushing teeth for 2 minutes at least twice daily. So we already know brushing teeth. How much? Twice daily. For how long? 2 minutes every time. In the morning and before going to bed. Because you have eaten some sugar substance, it's along the enamel or dentine layer, enamel, I hope. And then if you are not removing it in the bedtime, it will have all night party. The bacteria will have all night party. They will create plaques, acids, and then on long term, gingivitis can occur. Okay, we do not pay attention to these diseases, but these are important. Why are you here? Can you hide? Okay, better yet, brush every meal or snack. This is too much, but if someone is prone to this disease, is easily get this disease, gingivitis and periodontal disease, periodontitis. So better is that he or she brushes after every meal or snack. After, because once we eat, we need to remove the attached substance over to the teeth surface. Flossing before you brush allows you to clean away the loosened food particles and bacteria. So first you floss, you remove the big particles between the teeth, and then you brush your teeth to remove the bacteria and sugar substance or plaque from the tooth surfaces. Regular dental visits are one of another prevention for this gingivitis. See the dentist regularly for cleaning, usually every 6 to 12 months. So annually or 2 times a year. Annual dental x-rays can help identify diseases that are not seen by a visual dental examination and monitor for changes in the good health. So then annually performed dental x-ray, they help which the disease which are hidden, which cannot be seen by naked eye, and they also help in the progression or to monitor the progression of the dental health. And good health practices. What are good health practices? Brush twice a day, floss once a day, use mouthwash, stop smoking, maintain a well-balanced diet, not too much sugar or sugary substances, sugary snacks or sugary beverages, and then decrease your stress. Avoid clenching and grinding your teeth. If your children are doing that, then give them some supporting or plastic material which we can easily find it. Visit your dentist regularly for a checkup, twice or once a year. If you have a family history of gum, then you should talk about your dentist, and then maybe it will help to prevent completely. These are another signs. So what is gingivitis? Gingivitis is preventable common type of gum disease that causes inflammation due to buildup of bacteria causing plaque, leading to tartar formation. Once tartar is formed, it involves the local tissue, gum inflammation, gingivitis. Signs of gingivitis: we will have receding gums, exposing the teeth. Receding gums will expose the teeth. Bleeding gums after brushing, easy bleeding. Red and puffy gums, not pale and pink normally. Red and puffy, swollen, bad breath, tooth or gum pain. Teeth treatment: we have professional evaluation and cleaning, scaling and root planning, and then we have some preventive measures: brush, floss, smoking stop, limit sugary drinks, rinse your mouth. And now, once the healthy tissue has changed into gingivitis and we have still not taken care of gingivitis, it can lead to periodontitis. So this is the progression of disease. We have healthy gingiva, then gingivitis can occur. If not taken care, periodontitis can occur. And if not taken care, advanced or severe periodontitis can take care, which can let you to lose the teeth. So you can see the details here as we have discussed previously. These are some bacteria involved in this gingivitis. Most importantly cocci, actinomyces, gram-positive bacteria, and periodontitis, gram-negative bacteria. So gingivitis, gram-positive have more role, periodontitis, gram-negative have more role. And periodontitis predominantly anaerobic gram-negative organisms. Perfect. Now we go for periodontitis. What is periodontitis? As you already know, this is the progression and the bacteria involved. This is the progress of periodontal disease. As we know, there are two major types of periodontal disease: gingivitis, periodontitis. So we have healthy gum. When gums are involved, plaque are formed, tartar are developed, and swollen gums are swollen, gingivitis. Further leading to periodontitis when pockets are deepened, and then periodontitis not treated will lead to advanced periodontitis. How it leads from, as we already know, from healthy tissue to gingivitis, how gingivitis is developed, we have already read that. Now let's see how gingivitis leads to periodontitis, simple and advanced stages. Another example. Okay, periodontitis introduction. Periodontitis means inflammation of supporting tissues of the teeth. Periodontitis is the extension of the inflammatory process from the gingiva. Basically, the extension of gingivitis, the extension of the disease process of the gingivitis into the connective tissue and the alveolar bone, involving the cementum periodontal ligament, which basically supports it. So extension of gingivitis into the connective tissue and alveolar bone and other tissue, cementum and periodontal ligament, leads to periodontitis, where we already have plaque and change into calculus, and there inflammation already part of gingivitis already there. But now the pockets are deepening towards the apex, so that the alveolar bone and the teeth cementum has a gap, and then the tooth can easily come out or get lost. What are the risk factors for periodontitis? As you know, periodontitis is an extension of gingivitis. So gingivitis is the one of the risk factor leading to periodontitis. And then same as others are same as gingivitis, the risk factors, which includes poor oral health habits, smoking or chewing tobacco, older age, hormonal changes related to pregnancy or menopause, substance abuse, obesity, comorbidity, inadequate nutrition, including vitamin C deficiency, same as that. Genetics, gingivitis also related to genetics or family disease. If it's common in your family, then you need to take care, talk to your dentist. And certain medication that cause dry mouth or gum changes. When the mouth is dry, saliva is not there, the protective layer is not there, bacteria love to grow. And this is also another diagram showing the dynamic environment of periodontitis. Later in this slide, we have a bigger view. We will compare at that healthy gingivitis and periodontitis. That's why I have saved this for later. And what are the risk factors? Another form, there is a primary and there is secondary. Primary are initiating factors for periodontitis, and secondary are contributing factors. So primary are, for example, bacteria and dead cells and salivary proteins, form plaque, form calculus, and you see calculus, and the gingival sulcus has opened, there is gingivitis, inflammation, swollen comes, and the sulcus has widened, the pockets have been deepened, leading to periodontitis. Very good. What are the secondary causes? Some are local and systemic. Systemic includes immune, what is this known as? Immunocompromised patients, such as diabetes, which increase the which impairs the host immune response, and impaired immune responses. Impaired immune responses or immunocompromised state increase the risk of such diseases. And what are local? Sometimes, for example, you have to give some antibiotics, but the person has abused a lot of antibiotics in the past. So this antibiotic is not working because the bacteria are resistant and not sensitive. So resistance, increased resistance, and difficulty to remove if the plaque or tartar has developed a lot on the surface, is difficult to remove. These are the secondary local contributing factors and risk factors for causing periodontitis. And this is overall view. We have periodontium, alveolar bone, and then these bacteria will enter into circulation. And once in the circulation from the liver or directly towards different distal sites or peripheral organs, causing atherosclerosis, emboli, Alzheimer's disease, stroke, pulmonary infections, empyema, especially in Vincent angina, one of the major cause or complication of Vincent angina, rheumatoid arthritis, inflammatory bowel disease, diabetes are associated, and pregnancy-induced gingivitis you already know. So what are the stages of progress? As you already know, healthy gums leading to gingivitis, where gums are inflamed and plaques and calculus were formed. And then there was periodontal pockets deepening, causing mild periodontitis. When bone level are further reduced and further gaps are widened and deepens the pocket, moderate, more bone and tissue destruction. And then when there is extensive bone and tissue destruction, which can lead to loosen the teeth, the teeth can move easily and can lose the teeth and fall, the teeth can fall, is known as severe periodontitis. This is the stages of progression of periodontal disease, especially the periodontitis types, mild, moderate, severe. Okay, so we will stop the class here.